Hello everyone, I am Dr. Ravina and we are back with another episode of DocTalk. I hope everybody is keeping safe in the times of this pandemic. And while we are all really afraid because of the pandemic situation and we have stopped doing a lot of activities, but I have also seen that there is a trend that women have started to ignore their own health and they've ignored getting their routine checkups done in this process. In our talks, we talk about the different healthcare problems that women face during their whole lifetime. Previously, I have also already talked about breast cancer screening and breast health. So in this talk, I will be talking about cervical cancer screening. As we all know, cervical cancer is among the most common cancers in women all around the world. But the aggressive screening with routine PAP smears in the past few years has decreased the number of deaths because of cervical cancer. So it is very important that we create more and more awareness regarding this issue so that we are able to detect early and treat early. So what is called screening for any sort of cancer? Screening means finding out if there is cancer or not before any symptom has already occurred. When we do this, we are able to find cancer at a very early stage and we can treat it when it is actually treatable. Now, what is cervical cancer? Cervical cancer means that malignant cells that are cancerous cells are formed in the cervix. Cervix is the opening of the uterus into the vagina. The most common cause for cervical cancer all around the world is HPV, which is the human papilloma virus. While most of us may know about what is PAP smear, but people hardly know about the HPV vaccination. HPV vaccination is a vaccine which is given to prevent HPV infection, which is the human papilloma virus infection. So ideally, when you should receive HPV vaccination? HPV vaccination is given to young girls at a very early age. We can start at the age of around 11 years of age. We recommend giving it in an age gap of 11 to 25 years of age. And this vaccination gives maximum benefit when it is given before the first sexual activity. So it is very important that even young girls should talk to their mothers and they should talk to gynecologists regarding HPV vaccination and get it as soon as possible. Now coming back to cervical cancer. What are the risk factors for cervical cancer? So what are the risk factors which increase your chance of getting cervical infection? Cervical cancer. So as I said earlier, cervical cancer is most commonly caused by the HPV virus, which is the human papilloma virus. And the HPV virus is it causes an HPV infection, and that infection is contracted through sexual contact. So all the women who have become sexually active at a very young age or those who have multiple sexual partners, they are at an increased risk of having an HPV infection. Other risk factors for cervical cancer can be giving birth to many children, smoking cigarettes, any long-term use of oral contraceptives, or you can also acquire it if you have a very weak immune system. There are many other risk factors for the same. So the test which is carried out for cervical cancer screening is called PAP smear. PAP smear is a procedure in which the cells are collected from the cervix and the vagina. So cervix is the opening of the uterus into the vagina. In this test, what we do is we take the patient into an examination room and we give the patient a proper position, and then we use a brush to gently scrape the cells from the endocervical region, which is from the area of your cervix. Now this sample is then collected and it is sent into a laboratory. So in that lab, they see the cells under a microscope and they assess whether the cells are abnormal or not. So as shown in the image, the patient is made to lie in a position and then a speculum is inserted into the vagina and the brush is used to gently scrape the cells in the endocervical region, which is then sent to a lab for examination. Another test for cervical cancer screening is the HPV DNA or RNA test, and it is done in some of the places. So either doctors use a combination of both PAP smear and HPV DNA test or just PAP smear alone to check for cervical cancer screening. So the most important question is when you should start getting the PAP smear done. Each and every woman, even low risk women should start getting PAP smear starting at the age of 35 years. If the PAP result is negative, then you should repeat your test every 2 to 3 years till you reach the age of 65 years if everything is normal in it. If the PAP test is positive, then further confirmatory diagnostic tests are done by your gynecologist. So all of you who are watching this video, whether it is for your mother or your wife or your friend or your relative or any other relative, there is only one thing which is to be remembered and followed. Each and every woman should get a PAP smear done every 2 to 3 years after the age of 35 years. Only together we can create awareness regarding cervical cancer and beat it. Thank you.